Welcome to this presentation. My today's presentation is about brucellosis. Brucellosis is a zoonotic infection transmitted to humans by contact with fluids from infected animals or dry food products such as unpasteurized milk and cheese. And the etiologies of brucellosis: genus Procella are non-motile, facultative, and intracellular aerobic routes. There are certain species of Procella. There are 6 out of 6. Those 4 are the causes of human brucellosis. Those are Procella abortus, Procella maltensis, which occurred from goat and sheep, Brucellosis, which occurred from swine, and Procella canis, which occurred from the dog. Others cause animal disease, but it doesn't cause human disease. Procella neotome and Procella ovis, which occurred from desert woodwrats and sheep. When we see the risks of brucellar infection, one is exposure to infected animals, and feeding unpasteurized milk from goats or camels, history of travel to endemic regions. The endemic regions are Central Asia, Mediterranean Basin, African American areas are the common endemic areas. Consumption of exotic food or unpasteurized dairy products are the major risk factors which predispose to Brucella. Pathogenesis: the risk for infection depends on the immune status of the host, because well-immune person can prevent Brucella. So immune status of the host is very important determinant of infection. The route of the inoculum can be different routes. Species of Brucella also had different uh, clinical presentations. When we see the clinical presentation of a patient with brucellosis, there are triads. Fever, arthralgia or arthritis, and organomegaly, hepatosplenomegaly. Those are the triads of Brucella. Other non-specific manifestations like headache, diarrhea, rash, night sweats, weakness or fatigue, vomiting, cough, and pharyngitis can be the manifestations. In children, symptoms can be refusal to eat, lassitude, refusal to bear weight or stand or walk, and a failure to thrive. Those are present manifestations in children. When we see the clinical findings on physical examination, we can find hepatosplenomegaly, joint tenderness and pain, and virtually any organs, including bone, central nervous system, kidney, liver, spleen, respiratory system can be involved. CNS invasion occur in only 1%. In patients who had CNS invasions, the manifestations are headache, mental inattention, depression can be seen. In case of neonatal and congenital infection, this organism has also been described with different manifestations. How to diagnose? The first is history, physical examination, and the laboratory investigations. As we already discussed, we can have triads on history. We can have triads of brucellosis on physical examination. We can have joint pain, joint tenderness, hepatosplenomegaly, cough, mental status change in case of CNS involvement. When with laboratory evaluation, usually on CBC, we can have pancytopenias. And CBC pancytopenias can be seen. On culture, we can grow Brucellosis, but it needs special medias. The serum agglutination test, PCR, and enzyme immunoassay can confirm Brucellosis. When we see the treatment of brucellosis, combined aminoglycoside with doxycycline. Doxycycline with aminoglycoside can treat brucellosis. Prolonged treatment is the key for prevention of relapse, usually 6 weeks. Relapse is confirmed by isolation of Brucella within weeks to months after the start of therapy or end. There is usually not associated with antimicrobial resistance. So we can treat with the same antibiotics from the initial antimicrobial therapy may also complicated with Jerry-Skellimer reaction. Remember, Jerry-Skellimer reaction can be present also at the time of treatment of relapsing fever because of immune reconstitution. The options of antibiotics: we can combine doxycycline with rifampicin. We can combine doxycycline with streptomycin. We can combine doxycycline with gentamicin, or in children's. Remember, this is in children's greater than 8 years. In children less than 8 years, we can combine trimethoprim sulfamethoxazole with rifampicin or doxycycline in case of meningitis, osteomyelitis, and endocarditis. In case of deep-seated infections like this, we can combine doxycycline with gentamicin and rifampicin. The three medications can be used together in CNS and deep tissue infections. The duration of treatment usually 6 weeks. Doxycycline 1 to 2 weeks. Streptomycin 2 to 3 weeks. Prognosis. Before the use of antimicrobial agent, brucellosis is very fatal. It leads to death. After antibiotic treatment, most brucellosis patients recover. The prognosis after specific therapy is excellent. If patients are compliant with prolonged therapy, that outcome could be very interesting. When we come to prevention, eradication of the organism from cattle, goat, swine herds. Those are the sources of Brucella. So sources of Brucella uh, should be should be eradicated. We should eradicate Brucellas from the sources. Pasteurization of dairy products. Milk and dairy products should be pasteurized before feeding. That could be one prevention. No vaccines found yet. No vaccines found yet. This is all about Brucella. Good luck. I will come back to you with other videos. Thank you very much.